The U.S. has reached a grim milestone in the COVID-19 pandemic as the death toll has just surpassed 600,000. While some states may be entering a return to normal, more than 300 people in the U.S. are still dying from COVID-19 each day. Here's some healthcare workers with their take on the number of lives lost.
It is a grim milestone. It's very sad to think of that many people that lost their lives and that many families that are affected. But right now what we find is we still do have people passing away from COVID, and those deaths are challenging because from a nursing standpoint, we feel like they could have been prevented with the vaccine. So it makes it sometimes even harder to wrap our brains around those people that are passing away still.
I did have the opportunity to spend some time with a family member who was really close to their loved one. And I had spent several weeks with this family member, and I did know that despite everything that the doctors, nurses, and we as respiratory therapists had done medication-wise and everything, that this patient wasn't going to make it. And I had asked for a different assignment because I knew he wasn't going to make it. And on the day that he passed, I happened to be here, and I was on the other side of the ICU, but I could hear his family member crying and screaming because he was passing away. I think the thing that is one of the hardest things to be here and see these things daily that we see, and then to go out and to go home and try to live a normal life and to carry on with people who don't know what goes on in the ICU, who don't take COVID seriously, who don't think it's important to wear their mask, who have chosen not to get a vaccine. It is still very real. It is still something that is very serious and should be taken very seriously.
The toll this pandemic has taken extends so far, as we just heard. And as you heard, the United States has reached and surpassed 600,000 deaths from COVID-19. This means that approximately 1 in every 547 Americans has now died from this virus. And despite the vaccination rollout, more than 300 people are still dying every day. Joining us for more on this is infectious disease specialist at South Shore Health and ABC News medical contributor, Dr. Todd ELLERIN. Dr. ELLERIN, thanks for being here with us, as you have been really throughout this pandemic, and there is light at the end of the tunnel, but we do want to take a moment. In some ways, it feels like we're returning to normal, but on the other hand, we have this grim milestone, 600,000 deaths at least. There are excess deaths that may also be counted in that toll. To put this number in context, 600,000 people could fill Yankee Stadium more than 11 times over, Fenway Park 16 times over. So, how can we have this hope and yet recognize the devastation at the same time?
Right, Terry. Usually I'm not shaking, before I go on, but this is really hitting home for me, what we just heard. And it's really Dickinsonian, like you pointed out. As far as the 600,000 deaths, I've personally witnessed some of these deaths, and you're staring down at the patients who are dying, and then you have to look their families, their loved ones in the face and tell them that their loved ones are not going to make it home. And it's just devastating. And even now, while it's slowed down, there are still people dying. We've lost a person in the past 24 hours. And the bottom line is the majority of these deaths are in the unvaccinated population. So it's hard. At the same point, deaths have slowed down. In the beginning of the epidemic, it took 4 months to reach the first 100,000, another 4 months to reach 200,000, then 2.5 months to reach 300,000, then only 1 month in January and February to reach 100,000 each. So things really sped up. And then it's taken 4 months, actually, to get to the last 100,000 for 600. So you're right, we are doing much better, but we still have to urge people to go out and get that vaccine.
And we still have more than 300 people dying every day in this country from COVID. Now there are new concerns over this Delta variant, which we're seeing affect younger people more in the UK. Is enough of the country vaccinated to prevent another wave, which some experts have expressed concern over this fall?
It's really important, Diane, to look at this closely. There's no question that if you're at parts of the country where your community is getting vaccinated at a good clip, we're really seeing that community immunity, or what we like to talk about as herd immunity, where we're seeing cases go down significantly. The question is, how long is that going to last? And it's certainly not going to last if you're in a part of the country that's not vaccinated. The bottom line is the best way to prevent resurgences is to make sure that we get the majority of the country vaccinated. How much is necessary to prevent a resurgence of that Delta variant, let's say? We don't really know. And remember, we have to be careful because in the fall and winter, as we move indoors, it's going to be easier to transmit.
And Dr. Wall, some states have hit President Biden's goal of at least 70% of adults vaccinated with at least one dose. A lot of states are struggling to get their populations vaccinated, and vaccinations are going down. So how is this going to impact the spread of COVID with, as you note, this new Delta variant that's making up 10% of current infections in the U.S. and 90% just taking over COVID in the UK?
Right, so remember the Delta variant is about 40% more contagious than the Alpha variant, or the one that was first described in the UK. And that's important to realize. And one thing we've noted is that 2 doses of vaccine works much better against the Delta variant than 1 dose. So the good news in the United States is the fact that the 2-dose mRNA vaccines are separated by 3 to 4 weeks, whereas in the UK, there's often a 3-month separation. So I urge people to make sure that they follow up with that second dose. It's becoming even more important as these variants become more contagious.
And New York and California are just some of those states that have now reached that threshold of 70% of adults at least partially vaccinated. Both of those states are also easing restrictions now, but we're only at something like 15 states hitting that target so far. So how significant is that in this larger context?
Well, I think this was, reaching 70% for first dose by July 4th. I mean, that's obviously was I think definitely a challenging goal to reach. I do think when you look at the majority of people over 12, that most places are going to be near or at the 70% mark. I don't think there's anything magical about 70%. In fact, the goal is to really get even much higher than that, because we're hearing about these variants, as you guys are talking about, that are that much more contagious. And with winter, not that far away, and we're going to be congregating indoors, we really need that extra boost for protection.
All right, Dr. Todd ELLERIN, always great to have you. Thank you.
Take care, guys.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.